Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
To have a migraine is like having two hands squeezing your head, and it's awful, and you can't stop it. So you want to just crawl away in a dark corner and fall asleep until it stops.
I had no history with them, so I didn't know anything about migraine headaches. So when she was 12, she started to have them for like a day, but then last year they started with a vengeance. Like they just came on.
A normal headache, you don't get nauseous. You can just take 2 Tylenol or Advil and it'll just go away. But with a migraine, you get nauseous, you get dizzy, you get tired, you can't eat, you just want to sleep the whole time, really. You want to shut off all sounds and lights and just go to sleep.
Well, migraine is different than a typical headache, because if you take headache, it's like an umbrella term, and migraine is one type of headache. There are slight differences in the diagnostic criteria in pediatric migraine versus adult migraine. In pediatric migraine, you have to have a headache that lasts 1 hour or longer, sometimes up to 3 days. In adult migraine, it's 4 hours and can last up to 72 hours as well. But there's a shorter time frame for pediatric migraine. The location also is different and very important. In pediatric migraine, it's more frontal, in the front of the head, or bitemporal on the sides of the head.
I thought she'd have the flu, but when it went into the second day and she didn't have a fever and she wasn't getting better, I took her to the pediatrician, and she's the one who said, I think she has a migraine headache. And I'm like, a migraine headache? I'm like, okay, we just take Excedrin, we're done, this is it. And that's when she said, no, you need to take her to the emergency room, and there's special medication to give them to help bring the headache back down. And that was the beginning. The
non-functioning part is the worst, because you can't go to school and you can't talk to your friends. I didn't talk to my friends. I just didn't want to talk to anyone or deal with anything. I just kind of shut myself away. I was a drum major, assistant drum major, so that's one of the most demanding parts. So I had to be there a lot, early and late, and while I was lacking sleep and feeling sick and getting angry and frustrated, and it was all building up, and I couldn't get my school grades where I wanted them to be, plus I needed to do all this other stuff I dedicated myself to, plus dealing with things on top of that, like just high school in general. It was just too much.
People consider migraine in pediatric population not very common. And a lot of times they say, oh, you're just having a normal headache, when in actuality, they are meeting all the criteria for a pediatric migraine. And sometimes that delays the treatment. And if it delays the treatment, the brain begins to learn the pain pathways. And that delay in treatment can cause it to be more difficult to treat when it's actually diagnosed.
The treatments they've given me have helped a lot. They've given me something called Topamax, and I'm on 50 milligrams of that, and it's one of the lowest doses. So I'm really happy about that, because that means I don't need a lot of it. And it prevents them, and now I just have to take to a leave when I get a headache, which usually only happens when weather changes.
Putting a patient on a preventative medication is a big decision. And it's a decision not to be taken lightheartedly. I try to, in our clinic, match the correct medicine with the patient. There are several medications that have been studied in pediatric populations and shown to be effective to decrease the number of headaches, specifically migraines, as well as decrease the severity of those migraines.
I think the main thing that helped me is when Dr. Hastriter had me fill out, it's like a calendar. And we would write down not only what days the headache happened, but what was going on at the time. Was the weather bad? Was there some kind of little stress? I mean, just little notes. And after a while, you can see the pattern.
And in the case of Ariana, she's a 17-year-old female that had headache for 5 years. She came to me recently and finally got the diagnosis of migraine. And these headaches were very disabling for her. But once she got the diagnosis of migraine and we avoided all of the triggers, as well as put her on a preventative medication, we found that the number of headaches that she did have went down, as well as the severity of those headaches. So she wasn't disabled as she had been.
You just have to really watch what you eat and exercise, and you have to sleep and take care of yourself.
Sleep plays a huge role in migraine frequency. So if you don't have adequate sleep, you can have increased number of headaches.
If you want to be happier and have a happier life, you need to just admit that you're sick and you need help. Dr. H is the best doctor I've ever met, and he talks to me, and I've never met anyone nicer.
And you see patients such as Ariana coming back to your clinic and seeing a huge change in her life. But you also see a change in parents' lives because they finally have their child back. And I think that's one of the best feelings to leave work, knowing that you've decreased the morbidity of these teenagers that are going through already difficult times, growing up in those awkward years. And I love seeing patients back in a better situation.